Good afternoon. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy, and good afternoon, everyone. Today we're announcing 10 new cases of COVID-19, all in the Central Zone. We have 142 active cases today in our province. While the majority of the most recent cases are here in Central Zone, we also are announcing a few other cases in the Western and Northern zones. Dr. Strang will have more details on the active cases in our province. But what is clear, based on the evidence from public health investigation, COVID is in the Central Zone and is trying to seep out into other communities. That's why we are conducting asymptomatic tests in communities around our province. Outside of our regular testing stream, where people are going because they have symptoms, we've held a number of asymptomatic pop-up tests in Dartmouth, Halifax, and in Wolfville. And I want to thank those people who have volunteered to help us run these clinics. The lab workers who have worked tirelessly to ensure that the test results get out. And of course, the people who have turned out in the cold rain and have waited hours to get tested, even when you don't have symptoms. But by getting tested, you are helping those around you and you are keeping your community safe. This rapid testing strategy is not just an experiment. We are catching potential COVID cases. We have conducted over 5,000 tests so far, and 21 people have tested positive when they didn't have any symptoms. These people went home and isolated while they waited for the second test to determine whether indeed they were carrying COVID. This is a very good sign. Catching COVID in asymptomatic people is helping us contain the virus. But today we are also announcing another tool in our toolbox. It's mobile testing units. These mobile testing units will allow us to bring tests to community when and where it is needed. So tomorrow, one mobile testing unit will conduct tests in the Western Zone, one at Northeast Kings Education Centre. Dr. Strang will provide more details on that and others, but just let me say this. I am so grateful with the level of cooperation around testing. It is the best way for all of us to flatten the curve when it comes to COVID-19. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And just to repeat a little, yes, we are reporting 10 new cases of COVID-19, all of them in Central Zone. We have now 142 active cases, and fortunately nobody is in hospital. Since the second wave began, which we officially started that October 1st, we've now had 226 total cases. 84 of those are considered resolved. It certainly is a positive sign that our numbers have stayed stable and relatively low for the last few days. That's certainly much better than I expected, and especially when you say we've significantly increased the amount of testing we've done in the last few days. That is a good sign that we're relatively stable. But it's much too early to relax yet. A low and stable number of daily cases is just one of the indicators we look to when it comes to lifting restrictions. We also look at the average number of close contacts for each case, which I did talk about that a little bit last week. That number has grown since Friday. We now have, on average, 8 close contacts per positive case. And to put that into context, during the first wave, there were an average of 3 close contacts per case. And that simply means that on average, everybody who recently has been infected with COVID, there's 8 people around them that have been in close contact. That's 8 individuals who themselves might become infectious and then spreading it to others. So you can see why I keep saying we need to reduce our social contacts, keep our numbers, the people that we're in close contact with outside of our households, low. Because every additional person, we just increase the chance for any exposure to then amplify very quickly. We also need to see, so we really need to see, that to me is a critical indicator, the number of contacts coming down before we can say that things are moving in the right direction. Another indicator is how the virus is spreading. At the beginning of the first wave, our cases were either travel-related or close contact of a travel-related case. But in the second wave, most of the virus activity is happening in social situations. And the restrictions we have in place are designed to limit that social spread. So it's really important. It's because of that social interaction, the social nature of the transmission of this virus, that we need everybody to continue to respect gathering limits, keeping physical distancing as much as possible, staying home or going home right away if you're feeling unwell, wearing a mask where it's required, washing hands, and cleaning surfaces frequently. The restrictions that we have in place for the Halifax areas are going to stay that way at least until December 9th. As we get closer to December 9th, we'll look at all these the different indicators, and we'll decide if we need to extend the measures, and if so, which measures might need to stay in place and for how much longer. We're also certainly looking at if there's any cases in other areas, and is there a need for us to extend the restrictions geographically as well. So far, we have not had to do that. I'll talk a little bit more about the school we're investigating. The cases in the northern zone, all of them have been on the edges of the boundary between the northern part of the province and HRM, and all of their exposures have been in the Halifax area. I do want to talk about travel restrictions for a minute, because part of our restrictions that were brought in last week is that we are asking people to limit their travel into and out of the affected areas of Halifax. And those areas are starting with Hubbards all the way through under the peninsula, over to Dartmouth, all the way out to communities around Porters Lake, and then up north to Bedford, Sackville, Fall River, as far up including Enfield and Elmsdale, and over to Mount Uniacke. This is where our virus activity is focused right now, and we want to keep it that way. We know that when people move, the virus moves with it. And we want to do as much as we can to protect the rest of our province while we try to bring COVID under control here in the Halifax area. So essential travel is still permitted into and out of the Halifax areas. That means travel for school, work, or medical appointments. So if you live in Hubbards and work in Bayers Lake, that is essential travel. If you live in Lance and go to school in Halifax, that's essential travel. If you live out in the Eastern Shore and have a doctor's appointment at Dartmouth General Hospital, that's essential travel. So these kind of things can continue. It's important that we allow that to happen, including how we have many healthcare workers who we need to sustain our healthcare system. And unfortunately, I need to say this, but we have people that are traveled as part of essential travel should not be judged, stigmatized, or denied access to services in their home communities. I've been informed by some paramedics who work in the Valley, have as part of their work, transporting patients into the Halifax area, who are being denied access in restaurants in their home communities. That's not okay. They're there to help all of us. And this essential travel we shouldn't judge or stigmatize, and we should not deny care or support or access to service for anybody who is still traveling in and out of Halifax for necessary reasons. However, non-essential travel is an ongoing concern. Anything that falls out of the scope of work, school, or medical travel is non-essential. So coming into or leaving the Halifax area to go shopping should not happen. And unfortunately, I heard stories about that this weekend. Lots of cars in the malls in Truro, people saying they're from Halifax. I can't verify that, but it's troubling to hear that. I've heard stories about people planning to go outside of leaving Halifax to go out to get your Christmas tree. That's all very nice, you cut down your own Christmas tree, but this year, if you live within the affected Halifax areas, you need to stay within those areas and get a Christmas tree another way. I've even heard a story about people were overheard saying, well, we're going to go up to Wolfville and have our birthday dinner up in Wolfville, people right in Halifax. That's not okay. If you live in the Halifax areas, stay in the Halifax areas unless it's for work, school, or medical treatment. If you live outside the Halifax areas, don't come in unless it's for work, school, or medical treatment. It's critically important that everybody takes this seriously, because every person that moves unnecessarily is increasing the chance of the virus being spread to other parts of the province. So if you want to shop, that's okay, but shop close to home and respect capacity limits and other rules. It's certainly okay to get a Christmas tree, but find one close to home. And it's okay to celebrate things like birthdays or other special occasions, but again, if you're inside the restricted area, host it in your own home with members of your household and no more than 5 additional guests. We're also getting reports in government that people are coming into our Access Nova Scotia centres from outside of the affected Halifax areas. So if you live outside the affected Halifax areas and you have an appointment booked at an access centre that's within the Halifax area, you need to rebook that for an area or for a later time, or book it in an access centre that's not part of the affected Halifax areas. Many of those services can be also done online, like renewing your driver's license, your license plate. We'd encourage everybody to do that online. I'm also hearing stories from multiple places about visitors, and this is certainly at the Access Center is one of the places, that people are coming in not wearing masks. And it's certainly by anecdote, it's much more than you would expect with the percentage of people who have a legitimate reason for not wearing a mask. I'm certainly hearing the same about buses, and I had a conversation with Jacques Dubé from HRM earlier today, that people are just flat out refusing to wear a mask on a bus simply because they don't want to. We need to remember that bus drivers are essential workers, and for some, taking a bus is essential. We need bus drivers to come to work each day so that we can get where we need to go. So we have a responsibility to do our part to make their workplace safe. You may not like to wear a mask, that's okay. You don't have to like it, but you still need to do it. So stop looking for loopholes, stop making excuses, stop arguing with the people who drive our buses, who work in our access centers, and who manage our retail stores when they ask you to put on a mask. Masks are an important part of our COVID response plan, and they work. I was reading something yesterday, some recent research from the state of Kansas, where they left the decision about requirements for masking or not to a county level. And when they've gone back and looked at it, the counties that chose to have requirements for wearing masks had much lower levels of COVID cases than the counties that did not require masks to be worn. It's clear masks work. They're a necessary part of our multi-barrier response to COVID, and they are safe. And I know it's challenging to enforce masks because we still need to accommodate people who have a legitimate reason to not wear a mask. What we don't want is to set up environments where people are denied access to public spaces like stores or public services, like a bus, because they can't wear a mask. And I'm going to make this personal. I have a son with a significant disability. He's 15 years old. He cannot wear a mask. We are very careful about where we take him, but sometimes we do need to go in public places. So I use that as an example, as don't judge people who can't wear a mask. We don't know what their story is, but at the same time, don't make excuses for not wearing a mask just because you feel you don't want to. This is about rights and responsibilities. People have a right to a safe workplace. People who have disabilities have a right to access public spaces. And all of us have a responsibility to wear a mask if we're able to, and respect and accommodate the rights of others. So the bottom line is, if you can wear a mask, just wear one. No loopholes, no excuses, just wear the mask. It's the very least we can do to keep each other safe right now. Retailers and others, if someone identifies that they are simply choosing not to wear a mask, you do have the ability to ask them to mask or leave. And to the anti-mask people who I've seen footage of deliberately violating the masking requirement and deliberately getting in close contact with others while being forcefully asked to go away, you need to stop. And that's my rant on masking. I'll move on to testing. I want to provide a bit of an update on testing. Last week, I shared the details of our asymptomatic testing strategy, which includes 3 important new elements. First, the rapid testing pop-ups, which have been in several locations in Halifax and Dartmouth and made their first stop outside of HRM in Wolfville yesterday and again today. The team is also at the YMCA on Gottingen Street today. Since this pilot began, they have done 5,477 rapid tests, and as the Premier said, 21 positives. And all of the positives, because of the lower accuracy of this test, every positive has to be validated by a second PCR test. So we know that those tests are less accurate, and we are doing that validation. And that's an important step. But those initial results allow us to take rapid action. If people are positive, they're told to isolate until they get their confirmatory test. If they're negative, they said, well, it's a good sign. You're negative now. You still have to follow all of the COVID protocols, and if they're in one of the groups that actually have a higher risk of being exposed, like being on a notification list, then we actually say that they need to then we're actually asking those people to go get a PCR test, which is the second stream that we've stood up. So for anybody, you may have heard that anybody right now we're saying in the 18 to 35-year-old age group, if you've been working or recently been in one of the late night bars or restaurants in the Halifax area, we want all those people to come forward. And we've had 8,300 people do that. And I want to say thank you to each and every one of them. We're hearing lots of stories about how people are recognizing that it's not just for themselves, but they're coming forward to be tested because they feel that's one of the things that they can do to contribute to keeping the rest of their community safe. And we are continuing to do that testing, and of course any positives that come out of that are reported as part of our daily release. And again, going back to the pop-up testing, if we have a confirmatory positive from the pop-up testing, we report that as part of our daily release as well. Last Friday, we started routine asymptomatic testing for staff and volunteers in long-term care facilities. We've already tested over 250 people in 3 homes, Northwood, Ocean View, and St. Vincent's, and we're in the process of expanding that to 6 more facilities this week, and we'll continue to roll that out across the province, and that will be done on a regular basis, adding one more layer of protection to protect our most vulnerable citizens. And then tomorrow, as the Premier said, we're adding the 2 public health mobile units, which will start to be deployed to support better access for testing when we have things like an outbreak or a cluster and then we need to bring testing directly on site. These are 2 20-foot vans that are staffed by trained public health practitioners. They're trained now in collecting the swabs as well as doing all their initial public health work, starting out in counseling people on COVID protocols. These aren't the drop-in testing centers. They're not going to replace those. These use the actual swab for PCR testing. And certainly when we would deploy a mobile unit, we will work with community partners to make sure there's a notification of the surrounding community and we're getting the people that we're seeking to get tested to come in to get tested. So the first place we'll be using this, one of these vans is tomorrow, supporting testing at the Northeast Kings Education Center in Canning. At that school, we're continuing to contact people who should be tested, and we're asking them to, set up an appointment for tomorrow. Again, this is not a drop-in situation. We are contacting people directly and getting them to make an appointment. At that school, we've had 2 cases that we're still unclear about how they're linked, and we're doing this testing as a way to get a better sense of how the virus may have spread within that school community, if it has spread at all. So far, a lot of the testing we've done to date we've only had the 1 additional positive, but we need to do further testing among other contacts and identify any possible asymptomatic testing. So this is an important step. This is another, this mobility it gives us a much better tool to be agile and flexible as needed across the province. So I want to thank my colleagues in public health who have worked extremely hard on this. I was talking to them earlier today. Outfitting one of these vans usually is a 6 to 8 month process. It was done in 100 days. So thank you to the companies that did the work. Thank you to my colleagues in public health who were part of that and made this happen in as rapid a manner as possible. And thanks to all my public health colleagues who are now willing to do the additional training and now going to be part of these mobile units. There's one new measure we're putting into place today. Effective tomorrow, we're reducing the number of designated caregivers for residents in long-term care facilities from 2 to 1. So that means every resident can have one designated caregiver, and this applies across the province. I know this puts some imposition on families and the residents, but we felt it's a necessary step at this phase where we're at with COVID that we restrict it to one caregiver who then follows all the appropriate protocols to minimize the chance of anything coming in from the community into our long-term care facilities. We're nearly a week into the most recent restrictions, and as I've outlined in the metro areas of HRM and Hants County. And as I said, it's too early to be sure what kind of impact this is having. I'm encouraged by what we're seeing to date. Not only the epidemiology, but certainly the overall compliance, although I've identified a few challenging areas. For my colleagues at the Department of Labor, they visited a number of retail locations around the city this weekend as part of our ongoing monitoring and enforcement, and found that all of these retail locations were in full compliance with the COVID prevention measures, including reducing their capacity with a very short timeline to implement it down to 25% of their allowable capacity. And there we're going to continue to have that enforcement, especially at malls and our big box stores in the week and the weekend ahead. And I certainly recognize and I want to acknowledge for retailers how difficult it's been, especially at a time when it's a peak shopping period. But I want to acknowledge the cooperation and the understanding from the retailers and their willingness to be creative and adapted and to do their part as well to bring COVID under control. So as I said, we're going to continue to review our situation, and this time next week we'll be looking carefully at where we are with restrictions. Do we need to extend them? If so, is it a time frame we need to extend them? Do we need to extend them geographically? And also how we might start to lift them. But I think it's important for people to understand that even when we are able to start to lift restrictions, it'll need to be done slowly and carefully. The changes in how we shop are the first really visible way that COVID has and will impact our holiday season. But it's not going to be it's not going to be the only way. It's not just shopping restrictions. We need everybody to expect and understand that we're going to have a very different holiday season this year, one with smaller and fewer gatherings and less travel. Everybody's traditional holiday traditions will need to look different, whether it's where we go to pick up a tree. As I said, it's much smaller family gatherings, maybe doing virtual annual celebrations with friends and coworkers. But the spirit of the holiday season, for whatever reason you celebrate it, is more relevant than ever. And so I really encourage people to focus on what we have around gratitude and generosity, kindness and community, compassion and caring. Focus on those and how you give those, not what we're not able to do this year. We want everybody who's here this year to be around next year to celebrate our holiday traditions in a much more normal way. Before I wrap up, I just want to call your attention to the red ribbons that I'm not sure I forgot to give you yours, Premier. Do you have a red ribbon on?
Don't.
That's my fault.
I'm known to wear a lot of red, though. I can tell you that.
I have a second. My apologies. You're supposed to be wearing that. Anyway, the red ribbon that I am wearing, that I just gave the Premier, is World AIDS Day today and the beginning of Aboriginal AIDS Awareness Week. The COVID-19 pandemic has hit certain populations harder than others, and the HIV-positive community is one of those. People living with HIV are at a higher risk of severe COVID-19 infection, and this has created a lot of challenges when it comes to accessing and delivering services and supports. There are many people and organizations in this province who work hard every single day in our fight against HIV, and World AIDS Day is an important time to recognize that work. So I want to thank all those organizations, all those people for their dedication. And I encourage everyone to take a moment today to honor our friends and neighbors living with HIV and those who have died. Thank you, Premier.
Thank you, Dr. Strang. And just before we turn it over to questions, I just want to give I think for both of us, Dr. Strang and I once again recognize Richard and Deborah who are with us. They are ensuring that all Nova Scotians get the message, and I think we're all grateful that they continue to do that. So thank you on behalf of all Nova Scotians. Chrissy.
We'll take one question and one follow-up in the amount of time that we have for today. First question goes to Canadian Press, Keith Doucette.
Good afternoon. Dr. Strang, you mentioned your optimism around the numbers, and I find them fascinating in that 1 week ago today, as you recall, you reported 37 cases. We haven't had nearly that number, though the growth has been steady. So I'm wondering why we haven't seen the exponential growth. 37 didn't become 74, for instance, that we've seen in other places. And I'm wondering if it's because before you put on the restrictions, there was general adherence to measures that you'd previously put in place. Did that play a role perhaps in keeping the numbers down so far and recognizing that it's still early?
So I think there's a couple of factors at play, knowing that what we see today, as I've said before, is a result of what happened a week to 2 weeks later. We announced, it was a week ago that we announced substantive restrictions that came into effect, it'll be a week ago this Thursday. Prior to that, for 2 weeks, we were talking more and more at our briefings about the concern about the growing trend. And I think a lot of people, thankfully, listened to that and started to adjust behaviors. I certainly also know that in talking with certainly the downtown restaurant and bars, because they were becoming more and more necessarily having to be identified as places of possible exposure, they were seeing that their business was starting to drop off as well. So I think there was some adjustment about people's activities even prior to us putting the restrictions in place. That doesn't mean the restrictions weren't necessary. They were absolutely necessary to make sure we were getting on top of the surge of cases, and I certainly believe without those restrictions, we would have a continued higher number of daily case rates.
Follow up, Keith.
Around the restrictions, why wouldn't you just keep them, say, into the new year just to be safe? You may well, but you said you're going to reassess. But I'm just wondering that why wouldn't you say now that this seems to be going well? Why don't we just continue it to be doubly safe?
So it's going well, but on every restriction has its own set of impacts. And our overall goal has always been to minimize the overall impact, balancing COVID, what's in place to control COVID, versus balancing all the impacts or minimizing the impacts from the COVID restrictions. So it would not make any sense at all to continue restrictions beyond the point where they were necessary. We may well be in a place where we have to extend beyond the 2 weeks. I fully expect that even if we're able to start lifting restrictions, we're not going to be able to go back to where we were over the Christmas period, but it would be nice if we were able to start to loosen up a little bit. All of those decisions are going to be made based on what we're seeing on the epidemiology, and it is too early this week. It'll be this time next week when we're really starting to take a hard look and going, where are we at, and having those conversations within government about what does the next week or 2 weeks start to look like. But I think it's important that people understand, as I said in my remarks, this holiday season, whatever your traditions are, have to be COVID safe, are going to have to be looking very different, even if we are in a place where we're starting to lift some of the restrictions.
Next question will go to CTV, Natasha Pace.
Thank you. Dr. Strang, I know that the lab processed more than 4,100 tests yesterday. I believe that's the most to date for one day. But we're still hearing that some folks are taking more than 72 hours to get the results back. So is there a backlog in folks getting their test results, and is the system keeping up with the testing?
So we're aware of some of those challenges, and that is simply because of right now Public Health is calling everybody back with a test result. We also ask people to sign up to get a result by email. We need more people to do that, frankly. Lots of people aren't giving the email address, but we're also working at some other ways to expedite that kind of contacts that don't necessarily, if they don't have an email, that don't require somebody to make a phone call. So we're looking at urgent ways that we make this more automatic, if you will. But one of the ways we can do that right now today is that anybody who goes for a test, give your email, and that's the quickest way possible to get your test result back.
Go ahead with your follow-up, Natasha.
Thank you. Dr. Strang, I'm also wondering if there's an update on Bedford South School. I believe when you announced there was a case connected to that school on Friday, it says that the school will be closed until at least December 2nd. Do you know if that school will be open tomorrow, if it's closed for the rest of the week?
We are in the final stages of testing the contacts. That's going very well. We've seen no new cases. I want to thank the Minister of Education and his deputy and the people working in public education for their cooperation with public health. But that school will remain closed at least until next Monday. And then we'll reassess, but we're very encouraged by the cooperation from the community, and the epidemiology that's coming back looks very good.
Next question will go to Global's Jesse Thomas. Jesse, are you
Thanks. I guess this question is regarding the testing strategy. We're seeing these pop-ups emerge outside of the Halifax region where we have these restrictions, and maybe that speaks to what the Premier said with cases seeping into some border areas. I'm just wondering if we need to see any further testing strategies be implemented just for the asymptomatic population.
So we're certainly looking at that. The reason we've deployed it first into the Wolfville area is, as we talked about last week, we've got, a signal in the wastewater treatment there. We weren't sure what that means, but we need to pay attention to that. We also have a couple of cases in a local high school, so that certainly is very logically the place that we bring in that more mobile testing capacity, if you will. I think between the pop-up sites and the ability to stand up or increase capacity at existing access centers, or even stand up temporary access centers, along with the mobile testing van now, it gives us several ways that we can be quite adaptable and flexible. And we're talking right now about where do we take those potentially next. We always have to be cognizant that we have a number of streams of testing that we're doing, and we do, while we have greatly pushed the envelope on capacity, there are some finite capacities that we do have to work within. But we'll continue to look at how we can push that capacity and where we might want to go with this next. Certainly the asymptomatic testing is an area we're seeing that we need to pay more attention to, and that's been a discussion across the country.
I think one of the things Nova Scotians should be proud of, quite frankly, is the number of options that we have in our province to deal with COVID-19 when it comes to testing. In fact, we've had the continued testing model that we were using all along, where we had particular sites that were fixed in communities. We now have this pop-up site where we can actually move to a community where, as Dr. Strang just described, we potentially see a sign, as the community of Wolfville had identified. And now we have these mobile units which can actually put us directly on a site. Whether it's a school, a work site, it allows us to, or if we see a particular area where we see an outbreak, we can be in there in a hurry. That's a great tribute to the flexibility of public health and the cooperation that we've been able to do together. And I am very, very optimistic about our ability to actually test and control this, as long as every Nova Scotian continues to do their part, which is follow the public health protocols. Keep 6 feet, wear your mask, wash your hands. And if there is any indication that your community or family has an outbreak, we will show up.
Go ahead with your follow-up, Jesse.
Thank you. This is, I guess, just regard to the other strategy with asymptomatic testing with healthcare workers. Is that capacity limited to long-term care home workers at this point, or are we looking to do that into all healthcare facilities? I know recently Nova Scotia Health has said there might be 6 active cases among healthcare workers within their organization.
So that asymptomatic testing is for long-term care facilities. That is simply because all those workers are out in the community. So it's simply another layer with all the other things we've already have in place, is making sure we're minimizing the chance for COVID-19 to get into our long-term care facilities. We're all too familiar with the potential outcomes of that. It's important when it comes to other types of healthcare workers. It's important to understand that we have no evidence at all that their exposure was because of their work while they were providing providing care. They're all of the cases we've had in healthcare workers, and this is true across the country to the greatest extent, but certainly in Nova Scotia, all the healthcare worker cases, they've been exposed as part of their social activities out in the community. So there's no plans at this point of time to be actively screening all the healthcare workers in the acute care system. All my colleagues who are responsible for those acute care systems don't feel that that is necessary or appropriate certainly at this point in time.
Next question will go to CBC Jean Laroche.
Good afternoon, Dr. Strang. As you know, Phase 2 plan for long-term care involved the creation of regional care units, 6 of them. How big a problem is it in your mind that the one in the central zone, Halifax, which is seeing the most virus activity right now, isn't ready yet? As you know, Ocean View was supposed to service, if you will, 15 other nursing homes.
So I'm not intimately aware of the details of that, what's going on, but I think this is a short-term issue, is my understanding, that we're working on some of the staffing issues. I think we're fortunate right now that we have lots, and we have lots of other layers of protection in our long-term care facilities. They're actively working as quickly as possible to make sure that that facility is up and going as soon as we can.
Go ahead with your follow-up, Jean.
And as it relates to masks, over the past number of months, I've heard you cajole, I've heard you warn, I've heard you plead for people to put their masks on. Is there anything else you'd like to see the province do to ensure those who can wear a mask do wear a mask?
So this I am part of the province. So and this is something. It's as I started. He wanted to write a bad story, so he wanted to blame me. You can now go ahead.
I mean, this is a challenging one. If you make it required, then all of a sudden you've penalized people who actually have a valid reason for not wearing a mask. And we have to respect that. We have, like anybody else with a disability, we have to have accommodations. And I would argue, why do we have to police something when it's not that hard for everybody who can wear a mask to wear a mask? I think the challenge is for Nova Scotians, every single one, to step up and do the right thing and not rely on government to have to police this. Come on.
Next question will go to Stuart Peddle with the Herald. Stuart, are you there? Moving on to Lindsay Armstrong with All Nova Scotia.
Thank you. I'd like to ask the question to the Premier directly from the Auditor General report that was published this morning. What oversight exists to ensure that COVID-19 allocated funds will achieve government's intended outcomes? And when will the province release an economic recovery plan?
So I haven't seen what the Auditor General put out today. I can tell you we announced $220 million in stimulus spending capital plan. Every tender that has actually been awarded is actually on a website out in front of you. I've sat here from the beginning talking to you about the programs we've set aside to support businesses who were forced to close in the first wave. We set aside a program to deal with some of our tourism icons. All of that money's been accounted for, articulated to you and your colleagues. And we will continue to work with health. Obviously, there's some investments we're making in healthcare that'll be part of financial update when the minister makes that in the coming weeks related to healthcare. There was a cost associated with shutting down, for example, some of our surgeries that would be in the first round. I would also say to you there's a cost to our province. We were the only Canadian province to ensure that early childhood educators were paid through the entire wave as we closed them to make sure and to deal with the issues. But all of those things have been accounted for and will be part of the financial update and financial statements of the province of Nova Scotia.
Go ahead with your follow-up, Lindsay.
Thank you. I'm curious about the oversight piece of that question. Is there a function to ensure that the money is doing exactly as it's intended regarding COVID-19 support?
Well, I think you just described the Auditor General. The Auditor General has been the oversight really for not only my government, but for governments in the past. They continue to put out articles that will and review the spending in hindsight often, not at the moment in time. They usually review it in hindsight, pass judgment on whether or not it was the appropriate spending and whether it achieved the outcomes. I can tell you I am grateful for the men and women who have been hiring and rehiring Nova Scotians back into our workforce. I'm grateful for those Nova Scotians who've been on the construction side of our economy that continue to thrive through this period of time, keeping job sites safe. I'm grateful for the universities who've found a way to continue to welcome people into our province, young, energetic, educated people who are looking to be educated here, but also helping to build what I consider to be the skill bank of this province. That will be what we build out of this on. That kind of investment, we will continue to do that. But as always, the Auditor General, the opposition, you, the media will all pass judgment over the decisions we've made in hindsight. And I look forward to reading them whenever that happens.
Next question will go to Paul Legier with Radio Canada.
Yes, hi. This question is for the Premier. I'm working on a piece on the Auditor General's report today as well, and I'm just wondering what you would say to people who might look at the figures in this report and be worried about the increased deficit and net debt.
So I haven't seen what the Auditor General put out. I'm assuming you're referring to the province. I can tell you very proud of the fact that our debt to GDP ratio was over 38% when I came into government. We were on track to meet 30 by 2024. Obviously, this has made some adjustments to it. It's why we had to make all those tough decisions early on so that we could invest in Nova Scotians, we could invest in our economy, diversify our economy, provide new opportunities. We, as a province, leading into this pandemic, had seen the third consecutive year where more young people were choosing to live and work and create a family and grow a job in Nova Scotia. We saw an investment in the startup community, second only to Waterloo inside of Canada. So the foundation of coming out of this pandemic is solid. But I think all Nova Scotians want us to do what we can at this moment in time to try to support those businesses who are being forced to close. At the same time, making sure that our children are being educated in the right environment, in the safest environment, which would be a classroom at all possible. Ensuring that young people have child care. Those are the things that we continue to invest in and will continue to invest in. But the foundation is better in this province, that I would argue, than any other Canadian province to find our way out of this pandemic in a positive way. And I will do whatever I can to help whoever becomes the next Premier to do that and to continue to support this community.
Go ahead with your follow-up, Paul.
Yes, it's Dr. Strang. I'd like to know how many of the 21 people that tested positive with rapid tests also tested positive with a lab test. Do we have any sense of how accurate these rapid tests are proving?
Yeah, I don't have the full numbers in front of me. That's part of the ongoing evaluation, but I am aware that at least 2 of those were tested negative, so were considered to be false positives, but I don't have the breakdown of all 21.
I'm going to loop back to the Herald's Stuart Peddle. Stuart, are you there?
Yes, I am. Sorry about that earlier. I had a bit of a phone technical issue. My question is about the Northeast Kings Education Centre. We had heard through the grapevine that while students are not in school while it's closed, that teachers and staff are. Wondering if that is correct, and if so, how does the epidemiology show if that's safe or not?
So that has been the normal practice during this period of time. When we shut the school down, we go in and do an extra deep cleaning. I want to tell all Nova Scotians that at the beginning of September, we continue to increase the cleaning in every school across our province. But once we have a situation where the virus is in, we close it completely, go in and do that cleaning, and then our teachers go back to school as we keep the student body home. And online learning or support will happen from the individual classrooms out to those kids that are home, those students that are home. But if a teacher is a close contact to that virus, then of course that teacher would also be home for a 14-day cycle.
Go ahead with your follow-up, Stuart.
Follow-up is about the general restrictions. We've also had a business owner reach out who is running a fitness business, and they say that their model of business is more conducive to one-on-one that benefits social distancing. So they're wondering about the closing of their business might lead to further reductions of basic health and welfare, as they saw with their clients earlier with the longer-term shutdown. A lot of their clients who are older missed out on their workouts and essentially became less healthy. So that person brought their concerns to us, wondering if there's possible to do an exemption for a business model that is doesn't have such a large clientele coming into one space.
So I'm aware of that situation. Right now, we've said it's a time limited. As part of our regulations, we're being really tight. We're not giving exceptions and looking at special circumstances. I've learned very clearly through this, as soon as you do that, then there's a whole queue of other people wanting to give in the same treatment. So we're going to keep the restrictions really tight, including closing down all for-profit and not-for-profit gyms, fitness centers, etc. It's for a short period of time. They can certainly do some, like many other businesses in this area have done virtual online fitness and exercise classes. They can absolutely do that. But our goal is to remain very tight for the shortest time possible. And every time we give an exception, it creates another opportunity for a breakthrough that might then be the reason why we have to extend.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. Many of our listeners have long been interested, our readers rather, have long been interested in the wastewater testing, and I'm wondering if you can discuss that for a bit. And can you tell us who's conducting that and what the results are, and if there's any opportunity to bring that to other communities in Nova Scotia?
So that is we have a researcher here at Dalhousie who's part of a group of researchers across the country. And it is very much in the research phase. And the question is, what is the potential for wastewater treatment? So if you pick up a signal, you can't attribute it to any one person. But is there a role for screening testing wastewater samples for COVID-19 really as a very early detection method? And so this is this network of researchers. We're excuse me, still very preliminary. We're waiting to receive the full proposal on this research, even locally, to see where we might be able to extend it. And we're connected in with the researcher in terms of from an infectious disease and public health expertise, because the real question is, well, what is this really telling us? So it's just one line of research, as with COVID, that has some potential application. But I think people need to understand that we're connected in. And when there is a signal, even though we're not sure what it means, we're interpreting it that there may be something going on. And for this time, it was the Wolfville community, and we responded by acting and bringing in testing. The good news is that even all the testing we've done over the last over the weekend and yesterday in Wolfville, we're not, other than the couple of cases in the local high school, we're not seeing new positives, which to me is an encouraging sign that we haven't had spread into that community yet.
Go ahead with your follow-up, Tim.
With the, I think the Premier said that there were 8,300 people who got tested who were associated with the bars in HRM. I don't know if anyone knows, but is that all of them? Is that a big percentage, or do you have any feel for that at all?
So, I mean, there's no way to figure out what's the denominator in that, but what we have seen is that the number of people coming forward with that have started to drop off over the last few days. Certainly had great uptake. There was lots of awareness, lots of sharing on social media. So I think, and certainly the age group who are very connected socially and through social media were well aware of this. And I think our assumption is that we've reached the vast majority of them, and whether it's through the PACs or some of them were going to the pop-up testing, and we're starting to see a decreasing demand. We're ending that in the Halifax area on Tuesday, and we're in active discussions about what we do with that existing capacity and how we might use it in different ways around asymptomatic testing.
Next question will go to Kyle Shaw with the Coast.
Thank you. As other parts of the world get deeper into this second wave, we're hearing about overflowing hospitals, ventilator shortages. It's just like the first wave all over again. So, Dr. Strang,
Is ventilator capacity something you've thought about at this point in our second wave? Like, does Nova Scotia even need ventilators, or do we have enough? Do we get the ones we ordered in the first wave? That sort of thing.
So we built a ventilator capacity. We have sustained that. Certainly the right folks in the Nova Scotia Health Authority are working very clearly about making sure that we would have the maximal ICU capacity that we would need to if necessary. Our whole goal is to not even have to do that. If you look around the rest of the country, they have significant pressures on our healthcare system. So far, we've avoided that, and why we're acting so strongly, so quickly, is to keep it that way and to protect both our hospitals and protect our long-term care facilities.
Go ahead with your follow-up, Kyle.
Okay, and it actually is a follow-up related to hospitals. It's just amazing how we're at almost 150 active cases and nobody's in the hospital. So can you describe like the typical sort of care scenarios that these patients are getting and how exactly you've managed to keep them out of the hospital? I heard that some patients are on a blood oxygen machine at home and somebody at the hospital is able to monitor them, but I have no idea if that's accurate, and just wonder, how you've done this.
So I don't get into the details of individual care. The reality is that and I can't comment whether that's actually happening or not. The vast majority of people, in this age group, there's a significant proportion who are asymptomatic, no symptoms at all. The vast majority of them have mild symptoms and don't need, maybe a little bit of outpatient care. But there is a risk for severe disease. I don't want to diminish that, even in this age group. What we're doing, though, is trying to desperately work as hard as we can to keep the disease from spreading both geographically, but also keep it within this age group where the risk of severe disease is the lowest. And what we don't want to do is then have it spread into older demographics where then the risk of severe disease and the requirement for hospitalization and then the risk for death becomes substantively higher. That's why I keep coming back to all Nova Scotians need to pay serious attention to this. We're at a place in this second wave that outside of Atlantic Canada, no other province is in. They've missed that opportunity. We have the ability to get in control of this second wave and prevent those impacts on our healthcare systems and our long-term care facilities. But it requires everybody to do what we're asking them to do. No slippage, and I can say it again, no loopholes, no excuses. We can do it, but it needs everybody to do what we're asking them to do. That's how we keep each other safe.
I don't want to continue to add to this, but I do want to. This is the reason, as Dr. Strang said, we acted the way we did early on, to ensure that those of us who may be carrying the virus but feeling well, or quite frankly not having full symptoms, passing it on to someone who might have other underlying health issues. But to go back to the beginning of your question, knock on wood. We stay awake, quite frankly, ensuring that our acute care system is functioning. But let me reassure you and every Nova Scotian listening, if they require access to our acute care system, they will not be denied that. We have worked very hard to ensure that no one is being kept out of our acute care system because we don't want to put them on a ventilator or don't want to put them in the system. We are doing everything we can to prevent them from requiring or needing that. But the healthcare system will be there, continue to be there. We work with our partners at Nova Scotia Health Authority. We work with public health. And it is always, always focused on our healthcare system and the health of Nova Scotians.
That's all the time we have for questions today.
Thank you, Christine, and thank all of you. We are still under tight restrictions here in Halifax and some of Hants County, and those restrictions are also impacting people in other communities. You can't take a drive from your community to go see a loved one, and we've reduced the number of visitors in our hospitals and reduced the number of caregivers in long-term care homes. And of course, we've closed some businesses in our province, and I'm really sorry for that. But we need to continue to respect these restrictions. The question early on that was just asked a few minutes ago about our healthcare system, that's why we need to continue to respect these restrictions so that we can take care of one another. One of the things that we've relied on in the first wave was our ability to be kind to one another. Today is known as Giving Tuesday, and we are known for our generosity. Giving Tuesday encourages us to do nice things for people or find other ways to give back to our community, like supporting a local charity. We're also known for looking out for our neighbors. It's something we've always done. And I know it's hard to imagine, but right now in this pandemic, the best form of kindness is keeping your distance. So show your neighbor you care, but please do it 6 feet away and wearing a mask. It's the best thing that we can do for each other right now.